Hello, welcome to our demo video of UniBanQ, the medical education platform that helps medical students leverage AI to have a all-in-one platform to study medicine. So here I'm going to present one of our features, the virtual patient simulator. So the virtual patient simulator was developed to help medical students throughout their whole medical school journey practice for OSCEs and practice for clinical rotations. So you have access to tens of cases spanning different specialties, and basically it's super simple to use. You just have to click on a patient. For example, here we have Marcus Thompson, who presents himself with loss of consciousness during a basketball game. On the left side, you just have a few instructions to make your experience better. But when you want to start, you basically just click on See a Patient at the UniBanQ General Hospital. So once you're with the patient, you basically just have to start talking with the patient. You have about 8 to 10 minutes in the interview phase. If you click on the chat here, you're going to have access to real-time conversation history with the patient. You can either click on the button here to speak or put hands-free, so you just keep on talking and the patient is going to respond. So let's just go through a quick example. Hey, Marcus, how can I help you today?
Hey, I passed out during a basketball game.
Oh, I'm really sorry to hear that. Before you kind of give me more information about it, I just have a few questions to ask you. First off, just want to confirm, how old are you?
I'm 22.
And do you live with someone?
Yeah, I share an off-campus apartment with 2 roommates.
Okay, great. And do you work or are you still at school?
I'm a student, third year business administration.
Okay, got it. And do you have any allergies to medication?
No, I don't have any allergies.
And do you take any medication?
No regular meds, just ibuprofen sometimes for soreness.
All right, great. Do you drink any alcohol?
Yeah, occasionally.
Can you kind of just be more precise? How many maybe times per week?
Usually 2 or 3 beers.
Okay, great. And do you smoke cigarettes or vape?
No, never smoked.
Do you take any drugs?
No, I don't.
And how does your sleep look like? Like how many hours do you get?
Usually 7 to 8 hours a night.
And is it pretty stable? Does it happen for you to kind of just, I don't know, skip a few nights and just not sleep at all?
It's pretty steady. I slept well last night.
All right, great. Are you known for any medical problems that you followed for? Anybody in the family that has like any known health problems, especially cardiac problems or neurological problems like epilepsy?
Nobody that I know of, at least not that's been talked about.
So nobody in your family that you're aware of that maybe like lost consciousness in the past, especially around your age?
Not that I know of, really.
Okay, no problem. So tell me more about your loss of consciousness. What's the last thing you remember?
I remember sprinting, feeling my heart pounding, and then I got dizzy.
And what do you remember after you came back from losing consciousness?
I woke up on the ground with my teammates around me, feeling confused for a bit.
Is this the first time this happens to you?
Yeah, first time I've actually blacked out.
What do you mean blacked out? Did something similar happen to you in the past?
I've had a few times where I got dizzy during intense practice, but that's it.
Okay, got it. I'm just going to have to go, Marcus, but thank you so much for answering my questions.
Sure thing, no problem.
So just for the purposes of this demo, so I'll finish here, but you can go through the whole questionnaire, of course. Once you're done, you just have to move to the written questions. So you basically put your main diagnosis. So for example, here we could put, let's say, epilepsy, and then your differential diagnosis. So you could probably put like vasovagal episode and any other differential diagnosis that you have in mind. When you finish, you basically click on end session and you'll get a complete feedback that I'll get to show you. So here you have the complete feedback that's generated. So you have an overall summary of your key strengths, the areas to improve, of course, and just some practical tips for you to have a better question history taking. And for the history taking section, you basically have all of these sections you learn to ask as a medical student, resident, and also as an attending. And basically for the different sections, you're going to have either the section marked as complete, partial, or not asked. For example, here in the medical background, we did not ask this course, that's going to be mentioned. So you can kind of go through these different sections to see what you did well and what maybe you could do better next time. For the manual questions, you first of all have if you have the right answer or not. This is the answer that we expect for you to have. this is your answer, and then you have feedback at the bottom for 2 questions. You also have access to the complete conversational transcript to see a bit like how you ask the questions. Maybe you want to formulate differently next time, or just have a look at what questions you asked to compare maybe to your friends. So that's pretty much it. As easy as this. So feel free to subscribe to UniBanQ. Go ahead and try our OSCE patient simulators and give us some feedback. Enjoy.